Duchenne muscular dystrophy. So this is an inherited X-linked muscle wasting disease. The risk factors are being 3 to 6 years of age, usually at the onset. They're born with it, but we don't notice it until 3 to 6 years of age. They're male, and there may be a family history of Duchenne's muscular dystrophy. Some of the cues we're going to see in these patients is that they are reported by their parents to be very late to walk, that they are very clumsy, that even at ages like 3, 4, and 5 years old, they have difficulty climbing stairs, they have difficulty running, they fall frequently, and they have very large calves, even as a toddler. Then parents start to notice that there is some symmetrical weakness. It usually starts in the limbs and then moves to the trunk. So this occurs kind of over time because the muscle fibers are breaking down and degenerating. They develop something that's called Gower's sign, and that's where if you see a kid on the floor and maybe they're sitting crisscross applesauce and they need to get up very suddenly, most kids are able to just kind of use one hand and they jump up and there they go, and they're running and climbing and doing all the things that kids do. But these kids are maybe 7 or 8 years old and they have to use their hands to do this kind of walk up their legs, and provide pressure, and then a very wide stance to be standing. And you should Google it because it's Gower's sign and it's very specific. Those of you who are in class with me, I will demonstrate what it looks like. Then they develop a complete loss of the ability to ambulate somewhere between 7 and 12 years old. And they're also usually found to have some form of scoliosis. So the management for Duchenne's muscular dystrophy is mostly supportive in nature because there's no cure. These children are going to likely not live past their early to mid-20s. So we provide corticosteroids such as prednisone, basically lifelong, long-term, calcium supplements to help with their bone strength overall, vitamin D as well. We give them antidepressants because knowing that you are suffering from a degenerative, progressive, muscle wasting disease that will take your life is sad. We provide beta blockers and ACE inhibitors because that decreases the cardiac workload, and the heart is muscle tissue as well, and it will degenerate also and stop working. And then we give them braces and mobility aids and positioning aids to try to allow them to function as independently as possible for as long as they can. The complications for children with Duchenne's is that they develop frequent systemic infections because of the loss of mobility. They're going to suffer from ulcers and bed sores and heart failure and respiratory failure and dysrhythmias, and they're going to aspirate because the muscle tissue that smooth and skeletal, it's all breaking down. So they're going to lose the ability to swallow over time, and they will aspirate. And they also usually, before they even are diagnosed, have some level of learning or behavioral disorders. So those are all complications. And then, of course, after the cardiac dysfunction and respiratory dysfunction, it's usually death. And these are the nursing interventions and actions that we are going to perform as nurses. About it.